All right. So, is there anything else you'd like to ask me about the details of your lung cancer before we get on to your cancer treatment?
It's all new to me, so I'm a bit confused, I guess, is probably the best word. What to do, where to go, and how to do it, and where do we go from here?
Okay. All right. So you're booked to start treatment for the cancer in 2 weeks' time. The treatment involves having a dose of radiation to the lung cancer and the lymph nodes nearby every day. And when I say every day, I mean every weekday for 6 weeks.
So I'd like to take some time off work?
You would need to take time off work, In the first couple of weeks, it might be possible to just come to the hospital for an hour or so and then go back to work. But after the first couple of weeks, people start to get quite tired from the treatment.
Right.
And it would be best to have time off work completely.
Right. Okay.
And for a period of time after the treatment finishes, because people do feel quite fatigued and need some recovery time before they're able to go back to working full time.
So I've got some on service there, so I could probably use some of that.
Yeah. And we can provide you with medical certificates and anything else that you need. We have financial support services here at the Mater. People are entitled to Centrelink payments and things for illness and so on.
Okay.
Because you do need that recovery time afterwards as well, particularly when you're doing a manual labour type job outside and so on. That's challenging to go back to quickly.
Oh, okay.
The chemotherapy is once a week with 2 medications, and I'll come back to that in a minute. But basically, whatever day we give it the first time around, say it's a Monday, every Monday you have those 2 medications at low dose in the chemotherapy suite. It's a day-only procedure. You still have your radiation that day, but you go home. You don't have to be admitted to the hospital to have the chemo or the radiation.
Oh, okay.
The other very important part of your treatment to make it as effective as possible and give you the highest chance of being cured in the long run will be to help you quit smoking.
That's going to be a challenge, isn't it?
Yes, which sounds like it's news to you because it doesn't sound like it's something you've planned to do in the past. It hasn't been on your mind.
Never really thought about it.
No.
So I have to give up completely?
That's what I'd recommend you. We know that patients who continue to smoke during their cancer treatment and basically then on, so after a cancer diagnosis, are less likely to be cured of their cancer in the long run. We also know that patients who are having radiation as a treatment for their cancer have more side effects while they're having their treatment. If you think about high-dose radiation to your lung and at the same time your lungs are being exposed to cigarette smoke and tar and carbon monoxide and so on, the side effects to your lungs are significantly higher.
Oh, okay.
And that can mean, you become more unwell, you may need admission to the hospital, you may develop a chest infection, you may develop an inflamed...
That's serious, really?
Yes. Worst case scenario, if you have a severe reaction to radiation in your lungs, you may have to have your radiation temporarily stopped while your lungs recover.
Okay.
And that compromises the cancer cure as well. It's very important with radiation that we give it on time, every dose, without an interruption. The way that cancer cells grow basically means that radiation should be given.
So you can't stop start?
Not unless it's absolutely necessary.
Okay.
Yeah, it's really undesirable to have a break in radiation.
I really enjoy smoking though.
Yeah.
And it's the consequences, as you say, it may not help if I continue to smoke with the treatment.
The treatment's likely to be less effective.
Wow, you give me a lot to think about.